in generations due to the pandemic. And we here have total resolve and commitment to ensure that we continue to have health care for all. I represent South Central Los Angeles, Black and brown communities. Over 40, almost 50% of my community relies on Medi-Cal. So the attack by the Trump administration is the most egregious. And California has to reject it soundly, because we do not have amnesia, and we understand that protecting all of us and the health care of all of us is critically important. HR 1, as many of my colleagues and our friends here have said, is the result of $1 trillion being taken out of our healthcare system and given to the top 1% of this nation. The truth is that work requirements do not increase employment, it kicks people off of their health care. We do and must continue to stand with workers who are facing wage theft, who are facing affordability crises, who are facing the panic of a terroristic administration that is hunting them down and putting them into detention centers. We must stand with our communities to make sure that our working families, particularly our most vulnerable, are protected at this moment. Up to 2 million Californians could lose coverage, threatening our entire healthcare system. And we talked about what the costs will be on the other end and how much greater it will be than us ensuring that we maintain Medi-Cal and the protections for all of our workers. Even worse, the rising costs would trigger healthcare worker layoffs in a time where the shortage of healthcare workers is already at a crisis point. I sit on the BNP and we hear from all of our sectors about the shortage of healthcare workers, particularly in vulnerable Black and brown communities. In total, about 3 million working Californians who rely on Medi-Cal will lose their coverage. And in my county, what that is already looking like is that about a dozen clinics have closed. There are 1,300 layoffs that are planned and more to come. At the same time, we see some of the most wealthiest corporations get wealthier. In fact, one corporation went from a billionaire company to a trillion-dollar valued company. We know that California spends about $8,000 per enrolled worker per year. That adds up to about $28 billion annually that the taxpayer is footing the bill for healthcare for workers who are working for wealthy companies in this nation full-time. In other words, taxpayers are subsidizing a significant portion of healthcare costs for California's low-wage workforce. And while workers do their part every day, too many profitable employers are shifting, as my good colleague said, shifting those costs onto the public. Californians across the state, Democrats, Republicans, all agreed that big corporations must pay their fair share and that it is unfair for California taxpayers to foot the bill for health care for these employees. This moment is about unchecked billionaire expansion. It's about ultra wealth consolidated at the top of our income brackets, and it's time for that to stop. Fairness has to be the lens that we use in California. Common sense has to be the policy that we push in California. When public programs shrink, the pressure does not disappear. People see it and they feel it, and we know that the way that we fight back on this Trump administration, the way that we fight back is to ensure that we do not do their work for them. We provide the health care for all Californians. We ensure that every Californian has access to Medi-Cal and that we have a budget that is fair and reflects our values. I want to close by saying that this will not be the first time that we have this discussion, and we will continue to have it both in our caucuses, on the floor, in our meeting rooms, with our community, with our coalitions, to ensure that we keep the pressure on. And the pressure is to stay united, to demand investments that actually protect workers, protect their benefits, protect California values, and ensure that we resist and contest this horrible administration that is causing so much chaos and strife in the lives of our communities. Thank you very much.
Thank you, Senator Cuevas, for your leadership. What I love about all of the lawmakers that have joined us today is not only are they advocating for the voices of immigrants across the country, but they're also proposing solutions on how to fund Medicare and making sure that the billionaires and corporations that are profiting off the backs of our community don't continue to do that. And so it's my honor to introduce our last lawmaker speaking today, the Vice Chair of the Latino Caucus, Assemblymember Liz Ortega, who has championed immigrant rights and healthcare access throughout her tenure as a lawmaker.
Thank you, everyone. Assemblymember Liz Ortega, Chair of Labor and Employment and Vice Chair of the Latino Caucus, representing District 20. Thank you to all my colleagues and our community partners, and to the Californians that are out there. I think the message we're sending here today is health for all. So if you're a struggling mom who's working 2 or 3 jobs and still cannot afford to pay for the medicine that your child needs, we see you. For the workers who are building our homes and are working in very dangerous communities and very dangerous jobs, we see you. We see everyone who's struggling to make ends meet. And we cannot talk about affordability as a priority in the state if we do not talk about access to health care. We cannot talk about standing up to Trump and his administration if we do not talk about access to health care. We talked a lot about many numbers. A lot of numbers have been thrown out today. But I also have another number to add, and that is $170 billion that this state is now, or that the country is now spending on Homeland Security and ICE to hunt down our communities and to murder American citizens. So let's keep that number in mind when we're talking about access and healthcare access for all. I will close with saying one more time, we cannot stand up to Trump while we're icing out our own community members. We cannot continue to talk about what we do for the rest of the country without thinking about the families who are working hard every single day, contributing in taxes, both state and federal, without ensuring that they have access to health care. Because health care should be universal for all Californians, not just the billionaires who are the ones who have access today. Thank you.
Yeah.
Good morning, or good afternoon, everybody. My name is Annalie Alvarez, and I'm one of the organizers of the Health for All Coalition. I'm going to be reading out one of the testimonies that has been shared with us from a community member living in the San Fernando Valley. Diego C. has lived in San Fernando for 35 years, currently lives with his wife, is sick with chronic rheumatoid arthritis, cartilage disease, suffers knee pain, and has difficulty walking, and also has diabetes. His extended Medi-Cal coverage was taken away on January 1st, 2026. They only left him with emergency coverage. He will no longer have regular follow-up visits for his illness. He now must pay for his medications and is worried because his job as a street vendor and his wife's job cleaning houses, they barely make enough for rent. He says that it is impossible that having paid taxes all those years, he cannot access medical insurance. He is afraid that if he needs surgery, he will not have coverage and is very disappointed about this. He asked Governor Newsom to advocate for Medi-Cal coverage for him and for more undocumented families who need it and have contributed to the state's economy through their hard work and taxes.
Thank you all so much for coming. Thank you so much to our champions, not just for being here today, but for being with this campaign for years, and for being ready for the fight ahead. And thank you to our media for being here. We're not taking questions, but I know many of our speakers will be around.